Hi guys, today I want to share with you my experience on my Achilles tendon rupture injury. So there are two things that I want to share with you today. First is during the time of injury, and the second one is the recovery process, which is the first 2 weeks after surgery. So on October 9, we play basketball with my friends, and things go smoothly, and then but in just a sudden the injury happened. So first thing is what I feel something snap on my foot nearby on the heel, and then second one is I thought that someone kicked on my calf, which is cause very painful. Oh, it's mean like a painful somehow, like I can compare, it's like it cramps, but more than that. And so I noticed also that my calf went up, and on that time I cannot play back again on the game. At the same time, I'm unable to balance myself when standing. So I thought that it was just a normal injury, just like we play basketball all the time. There are somehow it sprained the ankle, or other things that happened on my foot. But I didn't expect that it is worse than that. So I waited for a week. I waited for a day before I went to the A&E in the hospital. And because I was checking on the internet what are the symptoms of having this kind of injury, pain in the calf, and then I found out that it was Achilles injury. So I decided to go to A&E after a day on October 10, and the doctor found out that it is Achilles injury after a test of Thompson test. From that point, what he did is he put the cast on my left leg, and I waited for a week on 17th of October to wait for the appointment on the orthopedic doctor. So after that, when the orthopedic doctor checked my foot, then he found out that it was confirmed that it is Achilles tendon rupture. So give me two options, whether either to proceed to surgery or another types of option. So the doctor told me that you better go to surgery because you're still young. So in my point of view also, that I need to go back to work as early as possible, and of course need to apply leave. So then I decided to proceed on the surgical procedure. So I waited another 4 days on October 21 to do the surgery, because there's no slot on that time. So yeah, I waited 2 weeks to go for surgery on my Achilles tendon rupture. So that's what happened. On that time, it was depressing, but then still need to accept the um, I accepted the fate as what happened, the injury, um, and then just keep praying to have a um, successful surgery. So the day of my surgery has come, and I'm excited because of the. I believe that my recovery process will start after the operation. And so during the operation, I was awake for the whole time, even until it ended. And I thank God that everything went well. And so far, the doctor told me that within the day, I can go back home, and but yet I stay there just in case for unnecessary issues that I cannot control. Then at least the nurses can help me. So there is a pain that you will feel um, after the anesthesia will gone, especially the anesthesia on your foot will gone. You can feel this thing. Um, Probably if I rate it from 1 to 10, I can rate about 8. If I didn't take any medicine, the nurse told me that it is more painful. So that is why there's nothing I can do but to bear on it. And yeah, but so far, on the next day, if I rate the pain, probably just if from 1 to 10, maybe um, 2. So there is pain, but not really. It doesn't really come out anyway because you're taking a medicine. So yeah, so that's how I think the first pain that you can feel is the first day after the time that um, after the after the anesthesia will gone. And so there are the medicines that I take are there 3 types of medicine. So one is like medium, um, severe, and very severe. So basically, I only drink these 2 types of medicine as required by the doctor. So um, if very painful, then I need to drink this other one. But so far, um, I only drink it once, just to try on it. But so far everything went well, and everything is bearable, and bearable. The pain is bearable, so the 2 medicine is enough already. So next is you need to take care our cast. So before was discharged, I was discharged in the hospital. My plaster cast was changed to the plastic cast, just like this one. So this is a plastic cast, which is removable. So air ventilation is good. And at the same time, it is handy, light. But even if it's light, when you put it on your injured leg, where it become heavy. So this one is handy because you can just remove like this, and that's it. You can remove and put it back. And the thing is, there is a schedule every 3 days to clean your wound. So it is very handy because you don't need they don't need to recast it. And yeah, just remove the my plastic cast and put it back after the cleaning. Then so this within 2 weeks there is a schedule for there's a schedule to clean the wound. And we have I have to take care my what's this, wound. Even I'm wearing this one, I still need to cover it with the plastic bag when I will go to shower. So speaking of shower is more challenging because you need to sit down, make sure that make sure that it is secured and not to fall down, which it will introduce for re-rupture. So you have to very careful, and at the same time when walking need to um, use the crutches to support. And I think for some of them they use this knee scooter, but so far I didn't use it. But within in the room, I'll just use the computer chair where there is a wheel on the chair. So far that it will help that gives me moving while sitting down. And of course, you need to elevate your legs at least 2 3 pillow to increase the blood flow on your foot. For the whole 2 weeks, this will happen to your legs, which is you need to take care of it. On that 14th day, um, the stitches, you will have an appointment to the doctor to remove the stitches. And on that time, they will give you a boot, call it air boot. But then during the time when my stitches was removed, the doctor told me that I will use this for a while, at least 3 to 4 days, to make sure that the wound will heal properly and use the boot. So just show you the boot like this. This is the boot. Yeah. So they will give you the boot, and which is I will talk to this boot for the next video. And yeah, to wrap up this video, make sure that we have be patient. For this kind of injury, it takes a while. Process of healing is a bit slower, so you have to be patient and stay positive. And of course, keep praying. For me, that is the way we can overcome the challenges.